Hello. Today we're going to talk about the importance of exercise in the early to moderate stages of knee osteoarthritis, a time when the joint hasn't deteriorated too much yet, but may gradually worsen if left untreated. If you only feel knee pain when moving, but it eases with rest, and you hear a clicking or grinding sound in the joint without any visible deformity, this video is for you. And here's the good news. This stage is where exercise can bring the most benefit. Why exercise matters. At this stage, the right exercises can reduce pain and slow the progression of the disease. In fact, it's even possible to delay the need for joint replacement surgery by years. Why? Because movement nourishes the cartilage, strengthens the muscles, and helps with weight control. So, what exercises should you do? There's a wide range of options at this level. Strengthening exercises. Focus on the quadriceps, hamstrings, and hip muscles. Movements like mini squats, leg presses, and lunges, when done properly, can be very helpful. Aerobic activities. Walking, cycling, and swimming are excellent low-impact choices. If you've been a runner and don't experience pain, you can continue at a light pace. In fact, studies show that regular running does not necessarily speed up knee degeneration. Flexibility and stretching. Daily stretches help maintain joint range of motion, balance, and proprioception. Even if balance issues aren't obvious yet, it's good to work on them. Try exercises like standing on one leg or Tai Chi. Pilates and yoga. Both improve flexibility and muscular control. They're highly suitable for this stage of osteoarthritis. How to structure your week. Aim for about 3 to 4 sessions per week. For example, Monday, Wednesday, Friday, strength plus aerobic. Tuesday and Thursday, stretching plus balance. Important reminders. People in the early stages can do a wider range of exercises, but that doesn't mean no pain, no gain. Pain is a signal. If your body speaks, listen. Incorrect technique can harm your joints. For example, during squats, letting your knees move too far forward or inward puts extra stress on the knee. If you're unsure, consult a physiotherapist. Avoid high-impact sports like indoor soccer or other contact games. These can increase the risk of meniscus or ligament injuries. Instead, stick with individual and controlled activities. What kind of results can you expect? When done correctly, exercise reduces pain and improves daily performance. Even tasks like walking stairs, squatting, or taking long walks can become easier, almost comparable to someone without knee issues. Does science back this up? Yes. Even tasks like walking stairs, squatting, or taking long walks can become easier, almost comparable to someone without knee issues. Does science back this up? Yes. A study in the Netherlands found that 12 weeks of exercise led to a 20 to 30% improvement in pain and function scores for patients with early-stage osteoarthritis. Many studies even show that exercise can be as effective as pain medication. Among regular runners, osteoarthritis didn't necessarily progress more. In fact, they often retain better function. Of course, this doesn't apply to elite athletes or intense training. High-level sports can increase the risk later on. That's why every program should be tailored and safe. Conclusion. If you're in the early to moderate stage of knee osteoarthritis, exercise is one of the most effective and safe treatments you can choose. It reduces pain, preserves function, and, when combined with weight control, significantly slows disease progression. Remember, a lifestyle supported by the right exercises helps you live a much better life with knee osteoarthritis. But always listen to your limits and work with a physiotherapist when needed.